When somebody is so desperate and you look at them, it hurts that you would do anything to try to help these patients, because in the long term, we're all God's children, and it doesn't matter who we are or what you do. So that's why we're here.
This is RotaCare, a nonprofit that helps people without insurance and offers them health care.
RotaCare is an organization that provides free health care for those in need.
We provide full medical care for them. We provide medications for them. We become their doctor.
When I first came home from Vietnam, believe it or not, I heard a couple of times and went to the VA hospital and they told me I didn't qualify for medical care. So I got into nursing in Vietnam. RotaCare is really all about access. It's about giving people access to healthcare. Healthcare, honestly, it should be a human right.
This is Rose M., and we've been treating her for at least the last 5 or 6 years.
This place is a lifesaver for me, because when I came in the beginning, I had nothing, and I couldn't go to the hospital. If it hasn't been for this place, probably I'd be dead.
Every day I come here, I help someone get through their lives and keep them alive and have a better life.
They go to the emergency room, they get enough medicine for a week, and then they're sent off. We maintain their health for an extended period of time, as long as they need it. A Christian attitude.
We believe that they are true people, true Christians who want to serve.
It helps my soul. It helps me feel that I'm part of the solution rather than the problem. I've always felt the need to help other people. RotaCare definitely has fulfilled that. One of the people here at RotaCare, gentleman has no insurance, but he's a very fragile diabetic. If it wasn't for RotaCare, this gentleman probably would be dead. And I think the people here have saved his life. And that's just one of thousands of RotaCare success stories that happen each week.
A young woman was referred to us. When we went to her house, it was a warren of rooms. And when we went upstairs to see where she was living with her husband, it was like one room and a closet and a sink in the hallway, and the sofa was a back seat of a car. There's no way that we could process what this condition was. It was just mind-boggling. People have no idea. Right in our backyards. They are near next-door neighbors.
After 25 years of teaching nursing, I came to RotaCare, and I've been here for 22 years now. A lot of them come in here, they're lost, they're hurting, they don't know where to go. One can see the desperation in their faces when they get here, because the head is down, they don't want to look at you. Some of them are crying. Don't be afraid to hold a hand, to put an arm around somebody when they're upset, because it builds up the trust. All the nurses, we're not young chickens, we're all in our 70s. And we really wish we could get more young blood in here. Young nurses, we need you. Please come to RotaCare.
They're desperate to see whether they can be helped with their medical, but also desperate for someone who understands what they're living through and what they're going through. And I've been blessed in the sense that I'm able to understand that on both levels. It was more than just being an interpreter. It was more of being a very important part of their lives. And they became a very important part of my life.
We have an amazing staff. They had the same reason for joining. They realized the need. They realized that we have to take care of these people, because if we don't, who is? We found this new home, which is here at 175 Fulton Avenue, and it's tremendous. It's a beautiful place. The problem is, after 30 years, we now have a big rental expense, and that's hanging over our head. So with this big extra bill of $80,000 a year, we really need support from our donors, from people who care about people, to kind of go onto our website and to donate. We want to expand. We want to do more. We want to be able to be open more than just the few times a week that we're open now. We need nurse practitioners, we need doctors, because they're the ones that prescribe the medicine. Here again, without the medicine, it's only half of the care for the patient.
Please come on down.
My hope for RotaCare is to be available for maybe 2 or 3 more days a week, which will increase the need for more donations. because that really is a limiting factor. With only so much money, you can only do so much.
This should not be about politics. These are our brothers and sisters.
They're just unfortunate that they don't have the coverage that many of us have, and that costs money. If they didn't come to us, we would be paying them going to emergency rooms, and we don't want them to do that. We want them to come to us. But in order to do that, we need to expand. And I want to thank you for the donations you've given us in the past. Thank you for the support you've given us. Thank you for the enthusiasm that you share with us, because we want to take care of these patients, and I know you do too.